Welcome to Jiminy Peak's Bloodborne Pathogens Introduction. This presentation has 3 parts: a slide presentation with audio, a short quiz, and a Hepatitis B Vaccine request or declination to sign. All employees will receive additional department-specific training. To continue forward with this presentation, you may use the right arrow key or Enter key. To move backward, use the left arrow key. To replay the sound, place the mouse arrow over the speaker and left-click. Staying safe from bloodborne pathogens. Safety tip: be alert and aware when handling materials that may involve blood or other bodily fluids. Jiminy has developed an exposure control plan, which includes this training, to help protect employees who can potentially be exposed to bloodborne pathogens as part of their job duties. If you administer first aid to an injured person in the workplace and there is a potential for contacting any body fluids, you should adhere to the following universal precaution guidelines. These guidelines include wearing impervious gloves when there is a chance of exposure to blood or body fluids, using resuscitation devices when performing CPR, and reporting all bloodborne pathogen exposures to your supervisor immediately. Immediately wash your hands and affected areas with soap and warm water. Flush your eyes, nose, or other mucous membrane areas with water if exposed. Wash down areas where body fluids may have been contacted with the use of a mild solution of household water and bleach, 10 parts water to 1 part bleach. If you perform janitorial or housekeeping duties, remember to adhere to these universal precautions. Never put your hands where you can't see, especially when cleaning. Be careful when handling trash bags, especially from bathrooms or guest rooms. They may contain used syringes. Never push down trash by hand. If found, syringes should be disposed of in a sharps container. Wear gloves when handling laundry, and never pick up broken glass by hand. Instead, use a pan and broom. The best protection against bloodborne pathogens are universal precautions. If you are exposed as a part of your job, make sure to report the exposure to your supervisor immediately. You must document how the exposure occurred. A hepatitis B vaccine, counseling, and treatment of any resulting illness will be made available to you. The key points are understanding what bloodborne pathogens are, learning what to do if exposed to them, and recognizing ways to incorporate preventative behaviors into your routine. Did you know Hepatitis B virus, or HBV, is more persistent than HIV and is able to survive for at least 1 week in dried blood on environmental surfaces? Human immunodeficiency virus, or HIV, will not survive for more than a few minutes when exposed to room temperature air. It will usually die within seconds. A teaspoon of infected blood may contain over 1 billion HBV particles. A teaspoon of infected HIV blood contains about 15 HIV particles. Hepatitis B virus usually has mild symptoms which make diagnosis difficult. HIV infections usually are not diagnosed for years, and symptoms may not appear for many months or years. Hepatitis B can be prevented with a vaccine. At the present time, there is no preventative vaccine for HIV. No cure is presently available for either HBV or HIV, but there are treatments to help control the progression of these diseases. Hepatitis A and hepatitis C are also serious viruses to avoid, and they can be transmitted through contact with certain body fluids or fecal matter. In most cases, the actual risk of transmission of a bloodborne pathogen following a needle stick is extremely low. The most commonly transmissible diseases of concern to nurses are HIV, HCV, and HBV. Of these, HBV is the most transmissible, with a risk of infection following exposure of around 6 to 30%. Staff that have achieved immunity after being covered with the hepatitis B vaccine are practically immune. Infection from HCV following a needle stick is around 1.8%, and risk of becoming infected with HIV is a mere 0.3%. Jiminy Peak's Bloodborne Pathogen Exposure Control Plan. The purpose of this exposure control plan is to eliminate or minimize employee occupational exposure to blood or other infectious body fluids. Other potentially infectious body fluids include semen, vaginal secretions, cerebrospinal fluid, synovial fluid, pleural fluid, peritoneal fluid, amniotic fluid, saliva, and any other body fluid visibly contaminated with blood. Departmental managers and supervisors shall be responsible for ensuring their employees comply with the provisions of this plan. The department manager is responsible for providing all necessary supplies such as personal protective equipment, soap, bleach, hepatitis B vaccinations, and etc. Hepatitis B vaccinations shall be coordinated through the Employee Safety Committee. The committee shall be responsible for training of all employees. The employees shall be responsible for using personal protective equipment that is provided. This section identifies all employee positions that are affected by the OSHA Bloodborne Pathogen Standard. Persons employed by the corporation in a position identified below will be provided training about bloodborne pathogens and work practice controls, and offered the hepatitis B vaccine. All employees must be offered training and/or shots within 10 days of employment. These positions include housekeeping, ski patrol, wastewater treatment, and other employees identified by their manager, for example, buildings and grounds. All employees in the departments listed on the last slide will observe universal precautions in order to prevent contact with blood or other potentially infectious materials. All blood or other potentially infectious materials will be considered infectious regardless of the perceived status of the source individual. Engineering and work practice controls will be utilized to eliminate or minimize exposure to employees working at Jiminy Peak. Employees must wash their hands or other skin with soap and water, or flush mucous membranes with water as soon as possible following an exposure incident, such as a splash of blood to the eyes or an accidental needle stick. Employees must wash their hands immediately or as soon as feasible after removal of gloves or other personal protective equipment. Employees shall familiarize themselves with the nearest hand-washing facilities for the buildings in which they work. Because most buildings are public access, they will have available hand-washing facilities in public restrooms. If hand-washing facilities are not available, use either an antiseptic cleanser in conjunction with a clean cloth, paper towels, or antiseptic towelettes. Ski patrollers should carry antiseptic wipes in their patrol belts to be used on the mountain. If these alternatives are used, then the hands are to be washed with soap and water as soon as feasible. Housekeeping employees who encounter improperly disposed needles shall notify the Safety Committee Administrator of the location of the needle. Additionally, the appropriate department manager at the location shall be notified. An example, Country Inn Manager, Ski Patrol Director, etc. Needles shall be disposed of in labeled sharps containers provided at the Ski Patrol Base Building, or known as PHQ, and Housekeeping Office. A. Needles should never be recapped. B. Needles may be moved or picked up only by using a mechanical device or tool such as forceps, pliers, or a broom and dustpan. Breaking or shearing of needles is prohibited. No eating, drinking, smoking, applying cosmetics or lip balm, or handling contact lenses is allowed in a work area where there is a reasonable likelihood of occupational exposure. No food or drink shall be kept in refrigerators, freezers, cabinets, shelves, or on countertops or bench tops where blood or other potentially infectious materials are present. Employees must perform all actions involving blood or other potentially infectious materials in such a manner as to minimize splashing, spraying, splattering, and generation of droplets of these substances. Decontamination will be accomplished by utilizing the following materials. A. A 10% minimum solution of chlorine bleach. B. Lysol or other EPA-registered disinfectants. All contaminated work surfaces, tools, objects, etc. will be decontaminated immediately or as soon as feasible after any spill of blood or other potentially infectious materials. The bleach solution or disinfectant must be left in contact with contaminated work surfaces, tools, objects, or potentially infectious materials for at least 10 minutes before cleaning. Equipment that may become contaminated with blood or other potentially infectious materials will be examined and decontaminated before servicing or use. No smoking, eating, drinking, or storage of food products is permitted in Ski Patrol patient treatment areas. Non-medical items such as clothing and personal effects should not be stored in the treatment room. Patient treatment areas will be maintained in a near sanitary condition at all times. The Ski Patrol Base Patrol patient care area will be disinfected with antibacterial and viral solution, at least 10% chlorine bleach or equivalent when required. All medical and personal protective equipment contaminated with human body fluids will be disinfected before being returned for use again. Broken glassware will not be picked up directly with the hands. Sweep or brush the material into a dustpan and then into a disposal container. Broken glassware shall not be disposed of in unprotected plastic bags. Known or suspected contaminated sharps shall be discarded immediately or as soon as feasible in containers that are closable, puncture-resistant, leak-proof on sides and bottom, and marked with an appropriate biohazard label. Reusable containers shall not be opened, emptied, or cleaned manually or in any other manner that would expose employees to the risk of percutaneous injury. Other regulated waste shall be placed in containers that are closable, constructed to contain all contents and prevent leakage of fluids during handling, storage, transportation, or shipping. The waste must be labeled or color-coded and closed before removal to prevent spillage or protrusion of contents during handling, storage, or transport. Red biohazard bags are available from the Ski Patrol. Housekeeping shall coordinate cleaning or disposal of contaminated laundry. Laundry contaminated with blood or other potentially infectious material will be handled as little as possible. To avoid special handling, all clothing and bed linens or blankets contaminated with human body fluid will be pre-soaked, sprayed on the infected areas with the antibacterial/viral solution before being sent to the laundry. Note: gloves and eye protection should be worn when handling contaminated clothing until pre-soaked for 10 minutes. Housekeeping will supply Ski Patrol with appropriate disinfectants for their use. Where occupational exposure remains after institution of engineering and work controls, personal protective equipment shall also be utilized. The corporation will provide gloves, face shields, masks, and eye protection, with the exception of ski goggles for Ski Patrol, at no cost to employees. The corporation will replace or repair personal protective equipment, with the exception of ski goggles for Ski Patrol, as necessary at no cost to employees. All personal protective equipment will be chosen based on the anticipated exposure to blood or other potentially infectious materials. The protective equipment will be considered appropriate only if it does not permit blood or other potentially infectious materials to pass through or reach the employee's clothing, skin, eyes, mouth, or mucous membranes under normal conditions of use, and for the duration of time for which the protective equipment will be used. Ski patrollers should wear ski goggles when treating injured skiers with a potential exposure on the mountain. Employees must utilize protective equipment in occupational exposure situations. Remove garments that become penetrated by blood or other potentially infectious material immediately or as soon as feasible. Replace all garments that are torn or punctured, or that lose their ability to function as a barrier to bloodborne pathogens. Remove all personal protective equipment before leaving the work area. Place all garments in the appropriate designated area or container for storage, cleaning, decontamination, or disposal. Ski patrollers should place contaminated gloves, medical waste in the biohazard container provided in PHQ. When full, the biohazard container should be given to the next ambulance to be transported and disposed of in an approved manner at the receiving hospital. The hepatitis B vaccination shall be made available to the employee at no cost after the employee has received the training in occupational exposure and within 10 working days of initial assignment. It shall be made available to all employees who have potential occupational exposure unless the employee has previously received the complete hepatitis B vaccination series, antibody testing has revealed that the employee is immune, or the vaccine is contraindicated for medical reasons. The hepatitis B vaccination is given in 3 shots spaced according to standard medical practices. Berkshire Occupational Health will administer the vaccinations on their site or at Jiminy Peak. If the employee initially declines hepatitis B vaccination, but at a later date decides to accept the vaccination shall then be made available at no cost to the employee. All employees who decline the hepatitis B vaccination offered shall sign the OSHA required waiver indicating their refusal. Employees will be tested after 3 years, or when recommended by the U.S. Public Health Service, to ascertain effectiveness of the vaccination. If a routine booster dose of hepatitis B vaccine is recommended at a future date, such booster doses shall be made available at no cost to the employee. The hepatitis B vaccine shall be offered to all employees of housekeeping, ski patrol, wastewater treatment, and depending on their job situation and likelihood of exposure, the vaccine may also be offered to buildings and grounds and other personnel as necessary. All exposure incidents shall be reported, investigated, and documented. When the employee incurs an exposure incident, it shall be reported immediately to their supervisor, who shall in turn report the incident to the Safety Committee Administrator. The Safety Committee Administrator, or his/her designee, shall contact the receiving hospital and request a blood analysis of the patient. If consent is obtained, the results of the blood test shall be provided to the employee. Should an infected employee or an employee acting as a Good Samaritan is occupationally exposed to HIV, HAV, or HBV, the affected employee will report the exposure to their supervisor. Jiminy Peak will provide for the employee to be tested for HIV, HAV, and HBV at Jiminy Peak's expense. Following the initial blood test at time of exposure, seronegative employees will be retested at 6 weeks, 12 weeks, and 6 months to determine if transmission has occurred. During this period, the employee will follow the recommendations provided by the physician or the U.S. Public Health Service. An occupational exposure is defined as blood or body fluid contact from an injured or ill employee to the affected employee or injury by a contaminated sharp object. Following the report of exposure, a Jiminy Peak representative will contact the exposure source and request that person be tested for HIV, HAV, and HBV at company expense. The request is not mandatory, and if refused will not affect the employee's future employment. The source individual's blood is tested as soon as possible and after consent is obtained to determine HBV and HIV infectivity. All medical evaluations shall be made by or under the supervision of a licensed physician, or by or under the supervision of another licensed healthcare professional. An accredited laboratory at no cost to the employee must conduct all laboratory tests. All medical records will be kept in accordance with 29 CFR 1910.20. All high-risk employees shall participate in a training program. Training will occur before assignment to a task where occupational exposure may take place, and at least annually thereafter. Additional training will be provided when changes such as modification of tasks or procedure affect the employee's occupational exposure. Any employee who is exposed to the infectious material shall receive training, even if the employee was allowed to receive the HBV vaccine after exposure. The training program will include at least the following elements. 1. An accessible copy of the regulatory text of 29 CFR 1910.1030 and an explanation of its contents. 2. A general explanation of the epidemiology of the symptoms of bloodborne diseases. 3. An explanation of the modes of transmission of bloodborne pathogens. And 4. An explanation of the employer's exposure control plan and means by which the employee can obtain a copy of the written plan. 5. An explanation of the appropriate methods for recognizing tasks and other activities that may involve exposure to blood or other potentially infectious materials. 6. An explanation of the use and limitations of methods that will prevent or reduce exposure, including appropriate engineering controls, work practices, and personal protective equipment. 7. Information on the types, proper use, location, removal, handling, decontamination, and disposal of personal protective equipment. 8. An explanation of the basis for selection of personal protective equipment. Location of spill kits are in the ski patrol building hanging in the first aid room, and spares are in the back room. The Country Inn front desk above the mail slots, the commercial laundry room desk with the first aid kit, and administration PCM's office. This is an example of Jiminy's disease report form. If an employee comes into contact with a bloodborne pathogen, a form must be filled out immediately. After completing the quiz, you will be asked to complete this form. At this time, you can choose to receive the Hepatitis B vaccine. Let us know that you have already had the vaccine or you do not want the vaccine. If you choose not to receive the vaccine at this time, you can change your mind at any time. Click on the link below for the quiz. You have as much time as needed and you must get a 70% or better, and you can retake the quiz.